Welcome back to another week of Staying on Top. I'm Nicoletta, and this week we are going to talk about herpes. True or false? You can only get herpes when the other person has an outbreak. The answer is false. So because there are these things called asymptomatic shedding, and because you can get it when a person doesn't have an outbreak, this is false. Condoms will protect you against herpes. This is true and false. So condoms and other barrier methods do help to prevent against the spread of sexually transmitted infections. You can also get it from skin-to-skin contact. And because condoms sometimes only cover a certain portion of your genitals, if you do have an outbreak on other areas of your skin or even on your eyes or other things like that, it's not going to protect you from that way of getting it. If you're in a monogamous relationship and you get herpes, your partner was cheating on you. This is false. I mean, sure, could there be the instance where you might get it because a person was stepping outside of the bounds of your agreed upon relationship? Yes. But like many other sexually transmitted infections, HSV can stay dormant in your system, meaning not active in your system for a long time. And so you might get an outbreak that's been there for years and could be from potentially another partner or another interaction. You can get genital herpes from someone who has cold sores. The answer is true. HSV can be transmitted to other parts of the body. So if you are giving someone oral sex and have either active or asymptomatic shedding cold sores, you can transmit that HSV1 or whatever it is to the genitals and vice versa. You cannot die from herpes simplex virus. Unfortunately, this is false, but it is very rare. So for most cases of HSV, like HSV1 and HSV2, you are totally fine. It's just a normal virus thing. But a lot of people have it. You usually don't have to worry about it. There are other morphings of the HSV virus, like sometimes people can get this strand of virus in their brain called encephalitis. And then also when you're transmitting it to a child during childbirth that might not have the immune system. But these are super rare, so please try not to worry. But if you want more education about this, I'll leave some in the links below. So HSV1 is herpes simplex virus type 1. So if someone says, oh, I just have a fever blister, or oh, I just have a cold sore, they really do have herpes simplex virus type 1. So I think a lot of people used to think that herpes simplex virus type 1 could only occur above the waist, aka on your mouth. But basically herpes, either type, can occur anywhere there is a mucous membrane. So that can be on the outside of your mouth, on the inside of your lips, sometimes around your eyes, on your genitals, around your anus. There are a bunch of places that we have mucous membrane on our bodies. I know this can sound kind of scary, but worldwide, 67% of people under age 50 have HSV1. The other common type of the herpes simplex virus is HSV2, and this is actually more common among women than it is among men. Though the numbers for this might be higher because a lot of times it's not detected if you don't have an outbreak, it's estimated that 11% of people under age 50 have HSV2. So if you are someone with HSV, then know that it can be easier to contract other sexually transmitted infections like HIV, because herpes simplex virus is something that can dampen your immune system. Let's talk treatment and prognosis. So unfortunately for HSV, there is no treatment, there is only management. And so there are a few ways to do this. Some people take natural supplements that help the outbreaks not happen so frequently. Some of these natural substances are things called lysine. There's also things you can do for your diet. I'll put some info in the links below if you're really curious about it. Another option that people use is to just avoid sexual interactions or other skin-to-skin contact with people when they have an outbreak. But remember, it is something that can be transmitted even if there's no outbreak. Another option that some people use is medication. So for example, there is one specific blue pill that is called Valtrex, and that is a medication that you can either take before you think you're getting an outbreak to prevent it from happening, or you can take it preventatively. So some people take Valtrex every day to prevent an outbreak. And using Valtrex definitely minimizes the risk potential for transmitting it to other people. One other over-the-counter management thing that you can use is Abreva. So Abreva is like a cream that you can put on or a lip balm that is supposed to shorten or minimize the outbreak time. So hopefully you've probably seen the movie Hangover when they said, oh, you know, you can, whatever, everything stays in Vegas except herpes. That'll stay with you for life. Like, I think there is this stigma for a lot of people who have herpes simplex virus and are worried about, how do I tell my partner? Will anybody love me? The answer is yes. Someone, obviously, many people will love you, and this does not have to get in the way of your intimacy, love, and dating connections. But then there is the question of, how do I talk to partners about it? There's some great resources out there in the links that I will leave below about how to talk to your partner, not just about herpes, but any other sexually transmitted infection, or to have those difficult conversations, because I know it can be hard to bring up. Thanks for joining me for this sometimes difficult but important talk about the herpes simplex or HSV virus. I guess V already stands for virus, but you know what I mean. So thank you for joining me. I know it can be a tough conversation, and know that there are ways to manage this and deal with it if this is a part of your life. A lot of other people do and end up having fulfilling, amazing sex and relationship lives. So it doesn't have to ruin anything, and you can help me by joining in a conversation so we can defeat the stigma around this topic.